everyone, and welcome back to another episode of Neurona-QL. Today, I'm really excited to be joined by Dr. Sajjad. Hello, Dr. Sajjad, and welcome again.
Oh, thank you so much.
Thank you.
Welcome to see you again after such a long time.
Thank you for being here with us today.
Mhm.
Today, we have a big topic to discuss, and that's on mental health.
Sure.
So let's dive deep in because I'm sure you've seen a lot of cases. You've been
Mhm.
introduced to a lot of patients from all ranges, all ages. Tell me a little bit what kind of sparked this interest because you're an OBGYN,
Mhm.
but you also deal a lot with like the mental health disorders.
Yeah, because I'm an OBGYN as a, whatever, certification you get, but I am also a board certified in integrative and functional medicine, which of course deals with the whole person as a whole. So even I'm doing the OBGYN, I'm not just saying, okay, what is their fetal heart and, what is the, fetal heart and what these labs are, whatever they do. I see them as a whole person. And I see if they have any issues, if they have any family issues, which is, bothering them, if they have any other problems or other kids who are having any issues. So many children I see now have autism. Autism used to be, God knows, in 1 in 100,000 before, and now it is 1 in 36, children, and now even more. So I have even in my office, people, who have kids or many patients who come, their previous children are having autism or any sort of mental disorder. So that is why I'm very much interested in all these things, and I, of course, I have not seen any patient so far who does not have at least any anxiety, sleep issues, or depression, or whatever. And everybody is on some sort of psychiatric medication I have seen. So you have to dig deep into them and see if they are on psychiatric medications.
Mhm.
Even these psychiatric medications, which of course with due apologies to the psychiatrists, because what they do is they hardly ask for any lab work or anything, or see full history. They might be taking some history if anybody's have a psychiatric issue in the family or no, or whatever, and they just prescribe some sort of medication to them. And next time they come, what it didn't work, they will add another one. Didn't work, will add another one. So it keeps on going into a big list. Okay, that's what I do not believe in, and I think we should, dig deep, dive into everything: their personal history, their family history, their sleep history, what they are eating, how they're spending their day, and what is bothering them, everything. What are their relationship inside in their family, they're with their own family, with their husbands, with their mothers-in-laws, and whatever they have. So all these issues have to be sorted out to see what is actually the root cause of their problem, and then that root cause has to be treated. Yes, and of course there are many things. I'm not in favor of giving any psych medications to any patient. I am in favor of treating them with their sleep and their food, whatever they eat. uh, so all that stuff. So I know a person who is a teenager and was taken into mental facility, came out of that after 14 months. And when he went inside, he was not diabetic. When he came out, he has gained like so much weight, and his hemoglobin A1C is 8.8%.
Wow.
He was not diabetic when he went in 14 months. What they did? How did they treat his psychiatric issue? He was diagnosed as schizophrenia. He's taking multiple medications for schizophrenia, and also he's been given medication for depression as well. So I don't know exactly, he's a schizophrenic or he has a major depressive disorder or whatever. Okay. But they have made him having physical issues also, means they have made him diabetic, gained so much weight.
Mhm.
So now, I have to take care of him. to reduce his weight, take care of his diabetes. And in the mental facilities, what they were giving him, they were giving him all sorts of carbohydrates, refined carbohydrates, which are instead of which actually make the problem worse.
Right.
Sugars make the problem worse. So that is what the first thing has to be stopped is the sugars and the carbohydrates, which are and processed foods. So they were being given all sorts of things in that mental facility. And now, he has, I don't know how much his mental issue has been treated. He has now become diabetic and obese. So that's what it is.
Since we're in this topic of the gut and the
Yes,
inflammation,
yes,
let's talk a little bit about that and how is that affecting the mood, maybe schizophrenia, depression,
yes,
and
yes.
how they all interact.
Everything starts from the gut. When people eat all these processed foods and all these toxins get out, from their gut into their blood vessels, and from blood vessels, they go into, whichever area you can say those toxins, if they go into of course, they travel through the blood all over the body. And from the body, they can, whatever part those toxins strike, means if they strike your joints, you will get rheumatism, rheumatoid arthritis. If they, go to your skin, you will have issues, dermatological issues, which will be, of course, related to autoimmunity. This is an autoimmune process. The gut needs to be, of course, treated first. And then, of course, along with the gut, their sleep issues, their food, everything has to be treated at the same time and taken care of at the same time.
So, since a lot of the issues start from the gut, how can we start to treat the gut in order to go to the root cause, basically?
Yeah. So, these, whatever issues I have told you, or the nutrition or the food, what they eat, that makes their, gut inflammatory. It gives inflammation in the gut, and inflammation, there is a single layer of, mucosa is a single layer of epithelium. So that, the cells, instead of being joined together, they should be joined together with tight junctions. So they get loose. And when they get loose, the toxins leak into that. And from there, it goes into the blood vessels. And the blood vessels, then they think, that something enemy has come in, and that blood cells, they react to it, and they make toxins or whatever, antitoxins, and then they go through that blood to body, and so the gut should be treated. So that the tight junctions, of course, there are many supplements, of course, like glutamine or prebiotics, probiotics. We have to treat the gut first, and then go from there.
Right. Because it's also one of the ideas that if someone has a leaky gut, even if they take supplements or anything like that, it's not being able to absorb as properly. So,
Exactly.
what are some of the things that someone can start immediately, maybe just like eating? You said, I know you love blueberries.
Of course,
Is
they
there,
are polyphenols, a
yeah,
lot of polyphenols. Yes, yeah,
anything else that someone you would suggest? And then it depends on everyone as far as like how do they respond to it. But what
exactly.
are some of the main categories of foods that you?
What I know I will do is, I will, of course, do all the labs and see what they are lacking in. Suppose I have seen patients, their vitamin D levels are like 5, 7, and then the doctors, whatever the doctors are, conventional doctors, they will say, okay, your vitamin D is 30. Oh, that's okay. So vitamin D, okay, is 30 is not okay. It should be optimal. The lab will say, oh, 30 to 100 is normal. So 30 is also normal, 100 is not, so it doesn't make any sense. And vitamin D is one of the most, important immunity, gives the body the immunity. It raises the immune system of the body. so that the body is able to fight whatever it is. So, and I have seen their B12s also. I have seen people's B12s like 150. Okay, and the lab will say, oh, from 250 to 1100 is normal. Okay, so 250 is also normal, 1100 is also normal. That's not true.
Right.
It should be optimal. It should be towards 1100, not towards 250, with this lab says, or 250 is normal. So it's not only good to do the B12. Of course, you have to check all Bs. You have to give them all Bs, and they should be like active form of B vitamins. Okay, because if your body is sick, it will not be able to convert those inactive B vitamins into active vitamins. So if you are, giving them some B vitamins, you have to check those supplements. What is it? Whether they are in active form or not in active form. You understand what I'm saying? Like riboflavin also. It should not be just like, it should be an active form of riboflavin, active form of, B vitamin B5, B9, whatever. And many people, and I have checked in my practice, I think maybe 90% in my, Southeastern community, which I deal with, and even Spanish people, and, a few, African American population as well. Many people have methylation defects. So these methylation defects are a big issue also. If they have any methylation issues, their body cannot do appropriate methylation. Of course, that also affects the brain. Yeah. So that also gives rise to. So you have to check if they have any methylation defects. Plus, then you check if they have any like toxins in the body, like metal toxins. Right now I'm seeing a patient who is. I was checking his blood lead, although the leads should be checked in the urine, not in the blood. His lead levels used to be high. I used to give him chelation, whatever, to chelate the lead, but every time he comes, his lead levels are high. And last week I saw him and I asked him, tell me what you eat. I found out that he's chewing pan. You know pan? What is pan?
I haven't
You
heard.
don't know. It is something, it's a plant, and they have the leaves. In those leaves, they put something and wrap it up, and then they chew it. And their teeth get yellow with that. And then I came to know, I Googled that pan has lead in them. So you can imagine, now I found out what is the cause of his lead in his
So you
body.
went to the root cause, yeah.
Exactly. So now I told him, please, you have to stop chewing these pans. Okay. When you go home, you would Google pan, PAAN, pan, and many people from, Southeastern population, especially, Bangladeshis, they chew pan. They have a lot of pan growing in their country. So they have, and what they have in their is, I think whatever they put in it has lead in it. Yes. So that pan has lead in it. So you can imagine, I myself learned this now. Okay. I could never think of that, that, and I thought he's a construction worker. So I thought maybe whatever construction work he is dealing with lead or whatever. But I know that now there are no lead pipes in America. Okay. Since quite some time. Before, there used to be lead pipes. Okay. So, and those lead pipes, when the water flows in that, it also, of course, erodes some lead, and that water is contaminated. So I check their water also, because I have something from Amazon. I tell them to bring your home water. I check that also, whether they have lead in it or not, because if their homes are like very old, maybe they were constructed in 2026 or 2020. So, they were asking that, okay, I check their water. I have something to check. Water is fine. So, and the wife is fine.
Yeah.
Because wife is not chewing pans. And I was thinking maybe this is his work related, maybe something is a construction worker, maybe the cement or whatever, bricks or whatever he's using, maybe that has led in it and that. But when he came to know that he's chewing pan, I don't know why I came. Maybe I saw his teeth, which were like
Mhm.
yellowish, and I asked why your teeth are like that. So he, okay, he's chewing pan. So that pan, and then I Googled that, okay, what that pan has. And I came to know, yes, there is something which they put inside has lead in it.
That's so interesting. Yeah.
Very interesting,
Yeah.
right?
And some of the things that some people eat or do, it affects the whole family. So if you find
Exactly.
the root cause to one, then you can find the
Exactly.
whole.
Now maybe if his wife was making pan for him,
Mhm.
her maybe her fingers also, and if he touches her tongue or whatever with that, maybe, but probably he was making his own pan because her lead levels were fine.
All right.
Yeah.
Let's talk about something in regards to like supplements. There's so many supplements nowadays. Take this or take that. But
Mhm.
let's talk about the active ingredients because
Yes.
another thing with the gummy bear, for examples, they don't have as much active ingredients in regards to as like an injection would have it, for example.
Mhm.
So is there a range that you would say what people should stay away from and what they should do
Of
that you
course,
suggest?
yeah. You have to always, when you are buying a supplement, you have to see which company it is because it should be really a good company and they should be organic. And plus, you have to look for it that what fillers they have used.
Mhm.
Sometimes, they use fillers, especially if they are not like organic. They use fillers, which also can be harmful. And some people I have seen that, if they take supplements, it doesn't suit their gut. They get some issues. They get nausea, vomiting, or diarrhea, whatever, they can get. I have to sometimes, change their supplement, see to some other company so that, they don't get those issues.
Mhm.
Yeah.
Would you suggest injections as the best type of thing, or is there some sort of like medications or anything like that, or it
Yeah,
depends?
injections also, okay, but same thing, like um, suppose let's take an example of B12, okay? B12, which is available in the market, even as injections, is cyanocobalamin, right?
Mhm.
So cyanocobalamin, of course, cobalamin is good. You need cobalamin for many. It is a cofactor for many enzymes in the body. Now, cyanocobalamin means they use a molecule of cyanide to
Mhm.
make those cyanocobalamin B12. No, I would not. I would give them methylcobalamin. So methylcobalamin, of course, will take the defects. The patient has a methylation defect, of course, it will take care of that as well. And if there is, uh, so that's it, either hydroxycobalamin or methylcobalamin, depending on whatever. And I always get from the compounding pharmacies
Okay.
because, yeah, compounding pharmacies, of course, the way they make things is not what is made on a commercial basis, in the market, available in the market.
All right. What about the combination of the vitamin D and the vitamin K?
Okay, let me explain to you. Um, Vitamin D, I have seen, people are getting 50,000 a week, which is not a good thing. 50,000 means divide by 7 means what? 7, 49, so 7,000 every day. Okay. I You can give anybody like 5,000 or even 10,000 every day, but their vitamin D does not come up. It is still, it was 5 you start with. After like giving them for 2 months, you check the vitamin D levels, it will be maybe 10.
Mhm.
Okay, so it's not working. So what happens is on the cell, so there is a receptor on the cell of the vitamin D. Okay, that receptor is activated by vitamin A. Okay, when vitamin A acts on that receptor, it opens that receptor. Then vitamin D enters that cell. Once the vitamin D enters that cell, then it absorbs calcium from the gut, whatever food they eat.
Mhm.
And that calcium stays and it can get deposited on your blood vessels, it can get deposited wherever it wants on your heart, arteries, but you you have to direct it somewhere. To direct it somewhere into the bones, which where it should go, you have to have vitamin K2. Okay, so that is why. So I check patients' vitamin A as well, along with D. So if their vitamin A is low, I give them A, D, and K2. A, D3, and K2. If their vitamin A is good, which I don't think anybody in my, I check the labs, never. Okay, so for me, my vitamin A is okay. Or they have to eat something like, good, like, organic carrot or something like a day or whatever, if they just want to take D3 and K2. Otherwise, you have to give them A, D3, and K2.
Okay. Very interesting. Now, let's talk a little bit about in regards to depression and anxiety,
Okay,
because some of them are kind of intertwined in between.
of
What are
course.
your thoughts on them?
Okay, even if somebody's vitamin D is optimal, you will see that their depression or whatever they have, like mental issues, have gone down.
Mhm.
Because vitamin D itself is takes care of your depression if your vitamin D is good. Okay, so that you have nothing to lose. It's just vitamin D. You are not.
Right.
But there are other supplements also, um, like magnesium, magnesium glycinate. Suppose magnesium glycinate also calms your nervous system, and magnesium is, of course, takes um, about 400 enzymatic reactions in the body. It takes part of that.
Mhm.
And you see the magnesium is also low. Plus, the doctors check magnesium in the serum. No, everything has to be checked inside the cell. How much? Because in the blood, it can float around in the blood, whatever. Unless it can go into the cell, it is not going to work.
Mhm.
So you have to check intracellular magnesium. Intracellular magnesium means you have to check in the RBCs, red blood cells. Okay, so that's what. Okay, so magnesium itself is calming to the brain. If you have anxiety, especially they should take it at night. If they have sleep issues,
Mhm.
it gives them good sleep.
Right. And now let's touch a little bit in regards to the sleep because everyone is different. There's so many interactions in regards to if someone should have 6 hours of sleep or 7 or 8. Is there such a specific time or
Yes,
maybe for specific ages?
yes. Okay, when you are a kid, of course, you should be sleeping like maybe 10 hours. When you are newborn, okay, before, when I was gone into the med school, I used to see, or, my own brothers and sisters, where they were born, they used to sleep for like 22 hours out of 24 hours. You understand? They used to only get up only when they wanted some feed or they have wet their nappies or whatever, but these days, you see that even the newborns, they don't sleep. They're very active.
Mhm.
It's so hard. I have seen, just I have my niece who is a doctor herself, and she delivered in June. Her daughter, she doesn't sleep the whole night.
Well,
You know, so that is what it is. So I have seen, if you give pregnant patients melatonin, if they take melatonin, it affects their babies and affects their pregnancies.
mhm.
It is the strongest antioxidant, which people think it is just something to sleep. It's not just something to sleep. Yes, of course it is. It helps you get sleep as well, but it has many other uh, good things which it does to your body. And I always recommend pregnant patients to take melatonin.
Mhm.
Yeah.
Now let's talk a little bit on the mental health when the mother is affected by some kind of like stress response and then how
Yes.
that is affecting the baby.
Yes, of course. That's what I'm saying. You have to, when you are taking care of somebody's pregnancy, first of all, I believe that if somebody's planning to get pregnant, they should come to the doctor at that time. 3-4 months in advance. Oh, we are married and we are thinking of having kids. So what should we do? That is the time. You do their labs, you check everything, you see how their, what is their household like? Are they living in a combined family? Are they living separate? Or they have good relationship with each other or no? Have there any issues? Those should be resolved first. Their D levels, their B levels, their vitamin C levels, everything should be optimal, and no sign of having any problem in their body. You understand what I'm saying? Um, no oxidants in their body which are affecting them, and they are mentally also. You can give them supplements, whatever, so they can have. Okay, as long as sleep is concerned, yes, the sleep should be from 7 to 9 hours. It all depends. It should not be less than 7 hours. Okay, so some people are okay with 7 hours sleep, some 8 hours, some 9 hours. It varies from person to person. I do not recommend that. Some see that first of all, and then they sleep very late these days. There's these cell phones. I don't know. They are very good, but on the same time,
Depends
they
how
are
you
like
use them. Yeah.
exactly because what I ask my patient, what time you sleep? Or 2 a.m., 3 a.m. Why 2 a.m., 3 a.m.? Oh, we are talking back home because here it is night and there it is like daytime. I said you can talk in the daytime also. It will be evening time over there, so you can But why you have to you know sacrifice your sleep hours so that you can talk to your parents?
Yeah.
So that's what it is. Plus these cell phones should not be your bedside, because they also give the what they call it, radiation type thing, which affects your mind. So you cannot sleep good if you have your cell phones on your side. And plus you should put them on do not disturb, because all the time people are sending WhatsApp messages, this message, that message, whatever, or even sometimes you get calls which are just God knows from where those calls are.
Right.
So you don't need all those things to what I do now, because I and plus I have these CGM, continuous glucose monitoring. And I've seen that there is one monitor which I don't know whether I should name it or no. It always shows my levels very low. Like my levels will be going at 54, 55 at night. I am fine. I have two CGMs. I have two CGMs from two companies.
We're
One,
not going to name the company.
I'm not going to name the company because I don't want to, whatever. But, the difference between them, one is showing 54, the other is showing 80. You understand how much difference?
Yeah.
Yeah. So I have.
And that's going to wake you up when
And plus, even
it's
if
at
I
night.
do, even if I put my phone on do not disturb, that alarm still rings when my sugars go low. Apparently go low. They are not low because I'm okay. I don't feel that I have to eat something.
Yeah. All right. So let's talk a little bit in regards to how glucose, when it spikes, it's affecting the mood.
Yeah. Of course, glucose is very important. And everybody should have glucose, of course, in his blood, but there should be some range. If it goes beyond its range, of course, it goes up into your nervous system also, and it negatively affects the brain. You understand? And you have heard about these things about keto diet, right? What is keto diet? And people say that if you have any mental issues or if you have any neurological issues, you should go on keto diet. Keto diet means minimal glucose, right? Mostly more fats and proteins. So that, brain can work on, it, that before we used to think that brain needs a lot of glucose to work.
Yeah.
That's not true anymore now. Brain can work better with the fats. Okay. So it can utilize fats. It can make the glucose from the fats. Of course, when, everything can get digested, it gets and into down to even all the proteins and everything can, of course, make glucose. And it is called, gluconeogenesis.
Mhm.
It can make glucose, and that if it makes a lot of glucose, if you eat a lot of glucose, that glucose gets stored in your liver. And then it can ultimately give you fatty liver. All right, so that's about glucose. So glucose or means sugars or any processed foods or like of carbohydrates, like breads and whatever those things are these days available. Potatoes. You go to, people are eating from McDonald's, people are eating from Burger Kings, and what they do, they serve you this much potato chips also along whatever with the buns, big buns, and it's a Big Mac and big this and big that. You understand?
Yeah.
So that what should not be done.
Yeah. Also, one thing that I've noticed in regards to a lot of people can be gluten sensitive in
Mhm.
regards to the gluten affects them very differently in United States compared to when they go in Europe, for example. And because of the foods, the gluten is not the same, I feel like, or the way that they make the bread is not the same.
Exactly, exactly. The food in Europe is much better. I recently went to Sweden,
Mhm.
and there I see that you hardly find any things like, organic written on them. You understand what I'm saying?
Everything is organic.
Maybe everything is organic. I was wondering because I went, with my niece, whoever was there, I went with him to the market, to the grocery. I said, listen, I am used to eating organic, so I will go with you. And I could hardly see anything organic.
Mhm.
Believe me, everything was like same.
Right.
So what was, I deduced from it was that, of course, maybe the food is good quality over in Europe
Yeah.
as compared to us in America.
Yeah.
Here, a lot of GMOs, and they put a lot of, chemicals, chemicalized glyphosates, this, that, and that is why this has now given rise to many diseases, many mental issues, many neurological issues also.
Mhm.
And as far as gluten is concerned, one of my friends, yeah, back home, she called me and she said that I have been diagnosed with epilepsy and I get seizures. And the doctors, the neurologists, they have put me one medicine, then they have added that I'm taking like 3 4 medications, but still it's not affecting my seizures. So what should I do? Then I said, okay. She said that the doctor has said that if you can get this medication from, it's available in only in United States.
Mhm.
And if you get this medication from United States, then it means, you will have to take it lifelong, and then you will not cease. I told my sister, who she's not no more living anymore. She was a pharmacist. I asked her. I said, "Listen, can you find out, what's the price of this?" And she told me the cost price. The cost price was $800 a month,
Mhm.
and that, my friend, she is a widow and she does not have to. I mean, I couldn't afford myself to send her $800 per month medicine lifelong,
Mhm.
right? Then I told her, I said, listen, do one thing, stop your gluten, stop your dairy, and stop your sugar.
Mhm.
Stop these 3 things and see how you do. After, I think, 2.5 months or so, I called her back and I asked her, okay, how you're doing? She said, I never got any seizure.
Mhm.
So you can imagine
Right.
how these, things are,
Right.
how this gluten, has affected.
Yeah.
And sorry to say that United States promotes its wheat everywhere.
Yeah. It's
Yeah,
so interesting how there's so many gyms in United States, but the
yeah,
obesity rates, like
yes,
rates are it is about to increase even more. So,
exactly. Yeah. So they're sending those seeds everywhere where it makes the yield much better.
mhm.
It, of course, it spoils your health.
All right.
Yeah.
And one thing that I think is important to ask because it depends, the output is whatever we input in our bodies. And
Yeah.
usually one thing is the food. And it's important to ask, how is that food about to make us feel like, and we realize it immediately. Are we feeling foggy? Are we feeling anxious after the food? Do we want to take a nap after we eat the food?
Yes.
That's very important to kind of ask.
Of course. Of course. Yeah.
Yeah. Another thing, let's talk a little bit about ADHD.
Mm-hmm.
I'm sure you've seen a lot because you deal maybe with like that age of kids.
Mm-hmm.
How important is to diagnose ADHD versus someone who's just a kid that's just like active and they just want to be active? Maybe that's their personality instead of just about to put them on the medications immediately.
Let me tell you one thing. You know, in 80s, in 80s, cholesterol was a big thing, like, okay, everything should be cholesterol free. Cholesterol is doing this, cholesterol is doing that, all those things.
Mhm,
And, eggs, you should not eat eggs, you should. So I have seen, people giving their kids only the white of the egg,
mhm,
not the yellow of the egg. And believe me, yellow of the egg is much more important than white of the egg. White of the egg is just, protein, albumin, 6 grams of albumin. You
mhm.
can eat like one chicken piece and you can get 6 grams out of that.
Okay.
But that yellow, in that yellow should be like orange if you are eating organic, real organic.
Mhm,
That is the more important thing. In those days, and people were doing, they were giving, taking out the yellow and giving their kids white.
mhm,
And what has happened, this has also given rise to mental issues, ADD, ADHD, all those things. You understand? Yeah, I remember when I was, my daughter was born, I used to mix the whole egg
mhm.
and in those days, the milk was also good. Nobody used to give injections to the cows and sheep or whatever,
Yeah.
so the milk was also very pure. I used to, the raw egg, I used to beat the raw egg and make the milk warm and put that egg. And when she was like maybe 3 months, 4 months, when you start introducing some diet, I used to give her that milk. Can you imagine? She is um, she also makes videos and everything. I think I
Mhm.
sent you her
I've seen
videos
her. Yeah.
also. Yes. So, that is a difference I see. What is the difference? And, you know, other children, later on, I see that people were giving them just the white of the egg, not the yellow of the egg.
Mhm.
And those children have developed these issues.
Mm. Interesting.
Mhm.
Yeah. And a lot of people, or a lot of kids nowadays, it's because also they're not taught in a way how to stay focused in
Yeah.
certain
So
things.
that
So,
that same thing,
yeah,
focus means whatever mental issues are, because if it has, they cannot, like, they cannot stay focused at one thing. They
right.
keep, going from here to here, here
Yeah.
to there to, yeah, that's what is happening with them.
And I think with iPads, with TVs, there's so
Exactly.
much overstimulation all at once
Yes, and
that, yes.
I see when patients come into my, to see me, they bring their young kids with them, and their kids are playing with their cell phones.
Hmm.
And if they take their cell phone, if I want them to show me, okay, what were their sugars, they take the picture of their, show me your this thing. And if they take the cell phone from the babies, the kids' hands, the kids start crying.
Yeah.
They're so used to this, and every kid has a iPad, with them. So from, this is, I don't know, I know um, these things are, lot, benefits, but of course there's always a dark side to everything.
Right.
This is
So,
the dark side that, we are suffering.
yeah. What would you suggest to parents that have the young kids, maybe like 2, 3 year old right now? What would you suggest to those parents?
I would suggest them not to give any screens to them.
Hmm.
Yes, they can learn a lot from the screens because there are, like I have seen, young children, they are learning because there are so many programs which teach them like ABC, 1, 2, 3, whatever from the programs they see on the TV. They
Hmm.
learn a lot. But of course, there should be a limit. And it should not be in the nighttime.
Correct. Yeah.
Nighttime, it will stimulate their brain and they won't be able to sleep.
Yeah.
You
Even
can
as adults, it stimulates our brain. So imagine to kids.
yeah, you can give them some screen time, wherever, like in the morning, whenever they are. Let them learn, uh, you know, but not to, you know, not to give them at night time.
Yeah.
Yeah, it should be one thing.
It,
Mhm.
it's very interesting. And then we touched a little bit on the ketosis diet. Let's touch a little bit on the fasting diet.
Okay,
Or
the
not
fast,
diet, but the fasting lifestyle.
yeah, fasting, it is the same thing. Fasting means you starve the body. When you starve the body, there is no glucose. So, what happens? You have a lot of fat in your body. So that, that fat is getting converted into glucose. And that, the brain or whatever you need, the body's energy needs are being met with that fat. So
Mhm.
that gives a lot of benefit. It makes your brain sharper. It makes your brain sharper. You are better off. And same thing, your mental issues and epilepsy, those issues are also resolved, you
Mhm.
know, get much better.
For sure. Another thing is when someone has gone through all these things, for example, like their sleep is regulated, their nutrition is regulated, but maybe they're still a little bit depressed or anxious. Is there a treatment other than antidepressants?
Yes, of course. There are so many supplements. Like, um, suppose I myself, I'm a very anxious type of person. I have a lot of, and um, I mean, due to my own issues, because, whenever I was very young, when my father passed away, we had like, 6 sisters. Younger one was like 1 year and 8 months or so. Brother was only, 5, 6 years old. I had to go through a lot. Yeah, so that made me so anxious that all my life, I was like unable to sleep.
Mhm.
So I when I started, reading or studying this integrative medicine, then only I came to know that how to resolve your anxiety issues. So I take like magnesium glycinate. I take at night. I take L-theanine, like 200 milligrams. I take 3 times a day. At least I have seen that L-theanine has made, I when I used to lie down sleep,
Mhm.
my I had brain racing, what you say. Okay, it will go from one place to the other. What should I do for that person? What should I be doing for that person? All the time. Means it was so stimulated that I couldn't sleep.
Right.
Since I started taking this L-theanine, that brain racing has gone.
Mm. Nice.
Yeah. Mhm.
Yeah. Is there anything such as
And
peptides or
plus
anything?
I have, of course, I try to go to bed by 9:30.
Mhm.
At the most 10 o'clock. I try to get proper sleep. So I mean, all those things which I am better off. At this age, also I can walk like 4 or 5 miles every day
Yeah. And you're
without.
very active and healthy, so that's awesome.
And all the I like whoever comes to my office to observership, I always push them through this type of thing, and they learn a lot.
Yeah.
The other day, I was in a doctor's, fundraising thing, And one doctor who is a PCP here, his son also, who is a medical student, he did some observership 2 3 weeks with me. And now his mother was saying, every time he says, why you are doing this, why you're not eating this, why we are not this. So why you are, why you are giving statins to your patients, why, so he's saying that you have transformed my son.
Yeah. Well, it feels like once you discover this other world, that there's so many like diseases that can be if you can find the cause and the root, it transforms the whole person, and then you can see how the medicine is kind of
Yeah, yeah.
how it's doing it. So
So these things are like very important. Your vitamins should be optimal.
mhm.
Your magnesium should be optimal. Your, your gut should be good, and some type of like and your body should be free of toxins, free
Mhm.
of metals, free of everything.
Right.
I think if you are, um, I don't think you will fall sick. I never get any vaccines. And I see every day one of staff is now these days are winters. Oh, I cannot come to the office because I'm suffering from cold or flu or whatever. I said, why you guys get these things? You
Yeah.
know, our
No.
body's immunity,
Mhm.
which is going to, protect you, not these vaccines. And vaccines itself, have aluminum in it, and I don't know whatever it is. And many kids we've seen autism. They say, "Oh, my child got this MMR. Next day he got high fever or whatever, and then after that he has become autistic. He was not born with autism."
Mhm. So, do you think there's a association with
I'm
the
a
fact?
very anti-vaccine. I don't know how, these companies who make these vaccines will think about it. But, that Kennedy, Robert F. Kennedy,
Mhm.
how much he is, he talked about Tylenol, against Tylenol and
Yeah.
against vaccines. You must have heard, right?
Yeah, yeah.
He's now he got himself back out of this.
Yeah, it wasn't interesting to see that kind of discussion. So,
Exactly, and how in the press so much against him was going on.
yeah. It's a
Mhm.
lot of the things that are coming now, especially after with like the COVID vaccine. So, and there's a lot of research that's coming that we didn't know from before.
Mhm.
So, but I think it's important to take into consideration like the benefits and the advantages at that point.
Okay, COVID vaccine, when COVID came, like end of 2019, right? Or 2020, they
The beginning
started
of 2020.
vaccinating in a minute, in like 2 3 months, the vaccine came out. You know,
Yeah.
how much they had the research on that vaccine. And now we are getting the after effects of that vaccine. Some people have gotten real myocarditis, things like that after getting those COVID vaccines. I never got any COVID. My whole family got it, and they got worst COVID infections. You know,
Yeah. It depends. Everyone is very different on that case. So, yeah, very
but
interesting.
this is. I say that every person should, get some lessons on integrative medicine.
I
It
mean,
is it is really, great thing. And infertility, you didn't talk about infertility. How many couples are infertile these days?
yeah. So, why do
And
you think that is happening?
same thing,
Yeah.
whatever they are eating. Look at their, okay, you are like, your BMI is what, 40? What were you when you came to United States? Oh, I was okay. I was not that obese. I was, this much kilos. Here we do it in pounds. Okay, so here they come, they start eating the junk food here they get, Their Pepsis and all those stuff. Even the diet Pepsis. It's not diet Pepsis are even. I tell people if you have to drink Coke or Pepsi, drink the regular,
Have the right, yeah. It's what's
not not the diet one,
yeah.
because whatever sweeteners they have, they are more carcinogenic.
Yeah. So in regards to that, the male and the female should be appropriately for the
Yeah,
testing.
yeah. I said I never treat any patient's infertility. I say I want to see your husband before I see you.
Yeah.
I have to see him as well. I have to do his labs. I have to see how he is. You know, and both of you have to be treated together. Not that husbands usually say, "Oh, I'm okay." Oh, you are okay because you can. You are sexually okay. It doesn't mean that you are okay.
Right.
You understand? Yeah. So that doesn't mean, you have to see what you're lacking, whether, the quality of your sperms is good or no. That also has to be seen.
Yeah. It depends on their nutrition, their stress
Yeah, of course.
level,
And of
everything as
course,
well.
if
Yeah.
they are nutritionally deficient, of course, their, semen analysis or whatever also will be not up to the mark.
Right. There's many factors. But
Yes.
I think with integrative medicine, it kind of like attacks all of them in
Yes.
all areas,
In all
basically.
areas, basically, yes.
Yeah. Yeah.
I
Any,
have seen people come from other doctors. Oh, they gave us Clomid, they gave us letrozole, they gave us, we are not getting pregnant. Oh, did they ever check your husband? Oh, no, okay. Did they check they just maybe check the semen sometimes, they do, but they don't know, how, whether the semen is also of good quality or not.
mhm. Yeah. It affects a lot because as there used to be this idea, oh, it's only the female that it needs to
Yeah,
be
they
tested.
all think that everybody, oh, I'm okay. When if the patient goes home and say the doctor says she wants to see you, oh, I'm okay. There's nothing wrong with me.
Right.
Yeah,
Yeah, that is interesting. Okay.
yes, yeah. And these autism, I have recently found out that they have, you know, their folate
Hmm.
cannot get to the brain. That is also one reason why they are autistic. You know, and folates, it cannot cross the blood brain. It's a bigger molecule.
Hmm.
It cannot go. Of course, forget about folic acid. Folic acid is a man-made synthetic thing.
Hmm.
And not everybody is capable of converting that folic acid into folate. That is also needs many steps and many enzymes. There many bodies, they don't have those enzymes to convert folic acid into folate. I don't know why they put folic acid. I never advise anybody, if any multivitamin has folic acid in it,
Hmm.
it should always be folate, methylfolate. Okay, so it's like leucovorin something. I have come to know that leucovorin folinic acid, which is called not folate, folinic acid, is the only thing which can cross the blood-brain barrier and go into their brains.
Interesting.
And there is a way of testing that also, which is called folate receptor autoantibody test. They have developed those autoantibodies in them. Yeah.
And then is that another way to treat autism?
Yes, yes, yes.
Yeah.
Now my interest is developing in treating autism as well.
It's becoming huge, and I think it's not just one thing. It's environmental, it's the genetics, it's a combination of everything. So
Have you heard about molecular hydrogen inhalation?
I've heard about the molecular hydrogen in regards to the inflammation in the brain, yes.
That not only in the brain, in everywhere in the body.
Everyone about it.
And it takes in seconds, it goes to the brain. In seconds,
Hmm.
it goes to the whole body and it goes to the brain itself also. I bought recently a molecular hydrogen machine for myself. I'm trying it myself first.
So there is some tablets in regards to those. You can either do tablets or there's a
There's
specific
a
bottle.
hydrogen tablets are there.
Mhm.
But of course, you have to drink it, and how much crosses your gut or no. And then, of course, you have to
Mhm.
And it is not like the inhalation, because inhalation goes seconds. In seconds, it goes to your everywhere, right, including your brain.
Mhm. So I have the water for now. I'll
Yeah.
have to update. Yeah, I'll have to update to the other one.
Yes, yes, I think you should.
Nice. Okay, I'll try that. Anything else that that you'd want to touch on? Any other research that you've touched on recently? Uh,
Recently, I just finished a book on this how to fix the autism.
okay.
Just yesterday, last night, I finished this book. Now I'm trying to um, read the book on how to treat schizophrenia,
Hmm.
how to treat it like in an integrative fashion. So I will be doing that. I have so many books I have bought, but didn't get chance to read them. Like fatty livers. How common is fatty
It's
liver?
very common, yeah.
I have treated many fatty livers, and when they go to the conventional doctors, they say, "Oh, there is no treatment for it."
Mhm.
Hashimoto's, all these autoimmune diseases.
So in regards to you say when you treat them, is it through peptides? Is it through a combination of hormones?
I have, I do give them peptides, and I myself take peptides. Like, I take BPC 157. I have seen, TB4 fragment and KPV. I have used a lot these three, and I have given to people who have like neurological issues, and it helped them.
Okay. Well, I think we learned a lot today. Thank you,
Yes.
Dr. Sajjad. Thank you
Thank
for being here today.
Always so nice to be with you.
Thank you. I enjoyed this conversation a lot. It's like one of the topics that I love talking about, so I definitely love this.
Mhm.